Welcome to State of Affairs. I'm Steve Adubato, coming to you from the Agnes Varus NJTV studio in beautiful Brick City, Newark, New Jersey. We're pleased to welcome, for the first time, Les Hirsch, Interim CEO and President of St. Peter's Healthcare System. Good to see you, Les.
Steve, happy to be here with you this morning.
You and I have had a whole series of conversations off camera about the state of healthcare. Where are we today, and how has competition changed?
It's dramatically changed. I'd say that the biggest factor driving change in healthcare is really the cost. In this country, we're the most expensive of any industrialized nation in the world, about 17% of gross domestic product. And if something doesn't change over the next 10 years, it'll be over 20%, and healthcare costs are projected to increase about 5%.
Why is that a problem?
Year. Well, the problem is, just in terms of the size of it as a percentage of the economy, it's just huge. I mean, we are much greater. So, what we see today is a push to drive costs down, and then you add science, technology, and healthcare delivery is changing. I mean, I work in a hospital and have for almost 40 years in different hospitals, but hospitals are no longer necessarily the center of the universe when it comes to healthcare. There are many other competitors that we have today. The way healthcare delivery is changing, different
example, we were talking about the CVS piece. I tell you, at our CVS in town, yeah. you can do what you have to do in a regular CVS, but then they got this clinic.
Right, and if you think about it, I mean, when we grew up, we remember neighborhood pharmacies, sporting goods stores, any kind of neighborhood store, and then the big box stores, and it became very corporate. Well, now those same organizations, they have clinics. They're seeing millions and millions of patients a year in these clinics. What potential, when you look at Amazon, a company like Amazon, with all of its reach, and when you think about access to a population, and if you tie an Amazon together with an insurance provider, I mean, who knows, how the future will turn. But healthcare delivery is changing dramatically.
How tough to lead a hospital? You have to make tough decisions about economics, about the number of employees you have, about just keeping costs down while providing quality care. Talk about that balance.
Well, it definitely is a balance, because we're not in a usual industry and situation where price is set by contract. We can't control costs completely in terms of the supply side, pharmaceuticals, medical supplies. And then, in our case at St. Peter's, we are one of the few remaining independent hospitals.
You're not, excuse me for interrupting, you're not part of a larger system. No. There are some very large systems in the state.
Oh, yeah. The consolidation in New Jersey has been extraordinary, in fact, unprecedented. We are an independent hospital, actually a Catholic hospital. We're in our 110th year in New Brunswick.
By design?
Catholic hospital by design?
No, Catholic hospital freestanding, meaning alone. Best strategy?
Not necessarily for the future, but we're in the process of looking to our future. But again, we are one of 7 hospitals in the country that are sponsored by a diocese. We're sponsored by the Roman Catholic Diocese of Metuchen. But whether you're a Catholic hospital or not, as an independent hospital today, you have to think about how and what you'll do in the future. So in our case, we're presently in the process of planning, looking to our future. But there's no doubt about it. We live in the land of the giants, and healthcare has changed remarkably. When I came into the industry years ago, there were over 90 community hospitals. Today there's 71. 58 of them are part of a larger system. And some of these larger systems have, for instance, 8 to 10 times the scale we do.
Les, what do you think it all means for consumers of healthcare who are looking to make the best choices for themselves, their families? Well,
I think ultimately what our responsibility in healthcare is obviously to provide a safe and effective environment for our patients and really assure access. And I think that's one of the biggest issues today is access. If you look at our country, we still have millions and millions of people that are uninsured, even though the Affordable Care Act helped with that. Many millions of people, certainly hundreds of thousands in New Jersey with the Medicaid expansion, got access to organized health care. So really you want quality and access and affordability.
Real quick, we're going to another segment on this show. Jackie Wright, we're doing a whole opioid crisis segment on this particular edition of State of Affairs. You have an initiative over at your place.
Absolutely. And St. Peter's, one of the things we do as a community hospital is outreach. And so we've recently established an opioid initiative. We're working collaboratively with school systems, superintendents, parents associations, the police. We have a program. I could share this flyer
you have a forum coming up
with you that is a flyer about a program that is available. We're working collaboratively with Chief John Zabrowski in the Saraville
In the police department.
Absolutely.
What are you looking to accomplish through this?
Well, I think first and foremost is education. I mean, we recently had a program in one of the schools with 1,500 students, and I think it's safe to say now that, I mean, it's very familiar for all of us. You know, we all know someone who's had heart disease, died of cancer or heart disease in our family, friends, and everyone. I don't think anyone could say they don't. And unfortunately, we're finding the same thing now is becoming true, that all of us, it seems, know someone who had an issue or lost a child. And, you know, just recently, you know, one within our own hospital family, you know, had the same thing happen with a child. So it's truly a huge epidemic, whether it's, you know, the heroin addiction or the narcotics, you know, the opioids.
Yeah.
Even in the way we treat patients, we're looking at that very closely.
What medication you give them, how long they have the drug, the prescription
and even
drug.
trying to do things in different regimens to control pain that are not necessarily opioid-based. So there's a lot of that going on, and especially at St. Peter's, you know, we're looking very closely at that.
Les, finally, in 40 years,
Yes.
just a few changes in the healthcare industry?
The only thing that hasn't changed is I haven't gotten older.
See? Same here. Nothing's changed in the media industry either. Listen, Les Hirsch is the interim CEO and president of one of the few, not that many, freestanding, if you will, not part of a larger system, hospitals. In fact, it's a Catholic hospital based in
New Brunswick.
Got it. St. Peter's healthcare system. Les, thank you for joining us.
Steve, thanks so much.
Appreciate it.
All right.
State of Affairs, we'll be right back. I'm thinking it will be, right after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by Holy Name Medical Center in Teaneck, New Jersey, TD Bank, Johnson & Johnson, Community Food Bank of New Jersey, New Jersey State Nurses Association and the Institute for Nursing, New Jersey Sharing Network, and by Rowan University,